there are some common unwanted or challenging behaviors in child development, such as tantrum, defiance, aggression, non-compliance, and 10 to 30% of children having those behaviors in a child care setting. Additionally, 1 in 6 U.S. children aged 2 to 8 years old had a diagnosed mental, behavioral, developmental disorders, according to the 2022 data from CDC. So those behaviors are common. Next slide. So these challenging behaviors happen for a reason. They happen because those behaviors are a way for the kids to communicate what they want, what they need. And it's also part of the learning as the young learners are interacting with the environment, and also part of the physical development. Next slide. Again, behavior challenges are a natural part of development, and many behaviors considered challenging are actually developmentally appropriate at certain ages. For example, for toddlers, having tantrums because they have limited communication skills by saying no, it's a way for them to assert independence. And for preschoolers, it is very common to see that they have a little bit difficulty sharing, and maybe they may have a toy struggle, and they may end up with some aggressive behaviors as well, as they are still trying to learn social skills. So again, this is part of typical development. In the meantime, we also want to keep track of that and see how well they are developing compared to their similar age peers. So I want to mention a helpful resource for tracking development progress, which is the CDC's Milestone Tracker app. It is designed for children aged 2 months to 5 years old, and it is entirely free and is available both in English and Spanish. I often recommend this to parents, caregivers, but also to anyone who works with children, as this is a really wonderful tool to help you monitor if a child's development across multiple domains, such as communication, behaviors, emotions, to determine if they are on track. For most children, again, these difficulties are situation specific and transitory. Next slide. However, it becomes a concern when these challenging behaviors are too intense, too frequent, or too persistent, and also having a significant impact. So, for example, behaviors that may result in physical harm to themselves or others, interfere with their ability to learn or participate in daily activities, or their social environments, it definitely would require further attention and support as early as possible.